The Mr. Clean study is a study we started 4 years ago. We wanted to investigate whether endovascular treatment is beneficial in patients with ischemic stroke. We got funded by the Dutch Heart Foundation and we set up a study including 500 patients, randomizing between standard treatment. Standard treatment for acute stroke can be with intravenous alteplase, so-called thrombolysis, and the other group was the group who received additional endovascular treatment, in which we allowed most available treatments right now. So one could use modern catheters like the stent retrievers, for instance. Well, when we started, we didn't know the results of the studies which were published in 2013 in the New England Journal of Medicine. And we knew that several studies were enrolling patients, but we thought about it and we saw that there were studies which were comparing directly endovascular treatment with intravenous therapy, and we thought to ourselves that's a bridge too far. We just wanted to show first that endovascular therapy has something additional to offer. That was one thing. And the other thing we saw about the previous studies was that they didn't require to show that the patients who were eligible for the study did have in fact a blocked artery. So those studies were including patients, but were not the right target in our opinion. Our targets were patients which were shown to have a blocked artery, the distal carotid artery, the main artery going to the brain, or the main principal artery of the brain itself, the middle cerebral artery. So what we did is that we demanded a so-called CT angiogram to be done first to select those patients who did indeed have a blocked artery. It's not anybody. So when you look at patients having an acute stroke, the severe strokes will have a blocked artery. So patients with a, let's say, who are aphasic, can't speak, can't talk, who have a hemoparalysis, those patient group often have a blocked artery, and this is specific for those patients. Patients with a minor stroke or a TIA won't benefit from this treatment because they don't have a blocked artery. There's always a risk. When you do an endovascular therapy, you're going with catheters, you're going inside the body, you're moving around with those catheters inside blood vessels with atherosclerotic disease. So there's always a risk that you induce a small embolus, which can cause a new blockage of a small vessel, and that's what we observed in our trial. We had in the intervention arm, we had 5.6% of new ischemic little strokes in different territories, as compared to only 0.5% in the control arm. So there is a difference. So that is a complication. It's a severe adverse event. But because those were only smaller infarcts, and you dissolve and you have a resolution for the large infarct, the overall outcome is better in the group which was treated.